Hello, I'd like to share some information with you today in regards to part two of avoidance coping and why it can possibly create additional stressors. This information is coming from verywellmind.com, written by Elizabeth Scott, and medically reviewed by Carly Snyder. So, uh, what is the link between avoidance coping and anxiety? Have you ever heard the phrase, what you resist persists? um, you've been introduced to the basic reasonings that avoidance coping can increase anxiety. So, when people use the strategy of consciously and unconsciously avoiding something that causes them possible anxiety, that can create a situation where you may need to face that issue concern more. So eventually, most of our relationships, uh, be it with friends, loved ones, coworkers, encounter disagreements, misunderstandings, or other conflicts related situations that may need to be addressed. So if you're avoiding having conversations that are necessary to resolve the conflict in the earlier stages, it can snowball at times to larger levels of stress to whatever that particular relationship is. In some cases, unresolved conflict may even end a particular relationship. So if you find yourself ending relationships rather than working through the conflicts, you will likely end up with broken relationships in a sense that you're not able to make a relationship work, if you will, in the long term. So the pattern can also apply to our thoughts. When we try to think of a way out of a bad situation to avoid getting hurt, rather than facing the situation, possibly resolving it, that can kind of increase or increase the stressor. So trying to determine every single thing that can possibly go wrong or reviewing all of the things that have gone wrong in the past to avoid the present and or the future can or will assist in the rumination or the ruminating thoughts. So when avoiding coping is actually healthy, some forms of passive coping, however, are not maladaptive and can be healthy. So remember that it's healthy to practice techniques that can help you feel calmer as you face a difficult situation, even if the techniques may not affect the situation directly. Kind of stress relief strategies like relaxation techniques and or moving your body physically can minimize stress response if you're facing a problem or even if the increase of your self-confidence, if you will. However, just because something minimizes our stress in one particular moment does not mean that it's a healthy form of coping. For example, overeating, over shopping, utilizing of substances may make you feel better in the moment, and though in the long term they may have consequences if they are overdone. So if we rely on strategies for stress relief, they can get out of control and create more stress. That's why it is important to seek the support and assistance of a mental health provider. So how to avoid avoidance coping. If you find yourself avoiding or avoidance coping, look for opportunities to replace these behaviors with active coping strategies. If you tend to um, utilize avoidance coping most of your life, or at least are a habit of using it, it can be hard to, just stop. That's why it's important to seek a therapist, a mental health provider, a counselor, a social worker that can assist you through utilizing beneficial, helpful coping skills that you can utilize. It's not one shoe fits all. They will assist you in identifying, practicing, processing those coping skills to assist you kind of getting to a more manageable place of lessening avoidance coping as well as ruminating thoughts. So, how to identify active coping options. If you're faced with a stressor, pause, look at your options. Can you reframe your thoughts and identify sources that you may not have realized at first? So, avoiding coping, it's kind of, for example, saying no to an invitation or saying no to something that you may not take part in, may not need to or would like to take part in to support them because you know that you may feel anxious or feel judged or by individuals that you may not know. So active coping, though, is making a plan, putting that into action, talking to that friend, that person you have a relationship with, and explaining to them your boundaries and the reason that you may not be in attendance or you may not be able to participate or so there are finding new ways to relieve your stress. So one of the passing coping strategies that have been found to be helpful is practicing stress relief techniques. If you learn to calm your body's stress response, when you're feeling stressed, you'll be less reactive and more empowered to be proactive when faced with a conflict. So, some emotional coping techniques can be journaling and meditation. I've spoken about this in the past before. In addition to finding techniques that assist in calming your psychologically, physiologically, they go hand in hand to soothe your emotions. Using healthy and empowering emotional coping strategies can help you feel less stressed and threatened by the stress and more prepared to face it rather than feeling the need to escape from it. So practice communication skills. If you tend to try to run or deflect from a conflict, you're not alone. Many people also have these practices, if you will, that are maladaptive. So with that being said, the first step can be it's a win-win situation, whether you speak with the person directly, whether that is you text them, whether that is you email them, whatever it is. If you're feeling like in the moment you may not have the opportunity to kind of speak in person, and also holding yourself accountable. So with that, you may want, I'm going to utilize the example of a friend. You may want to ask a friend to help you as you work on getting rid of your avoidance coping strategies. Sometimes you need a little nudge and support from an individual. And in this case, I want to stress an unbiased person, which can be a mental health provider. So learning to tolerate uncomfortable feelings. So once you become kind of accustomed or have practiced kind of having uncomfortable moments and kind of like going through them, facing the problems head on, you may not have as increased anxiety. So one technique is mindfulness, and mindfulness can assist with or does assist with being in the present moment and checking in with your mental, emotional, and physical being. So, observing your feelings, breathing through them, and becoming better acquainted with the idea of sitting in or with discomfort can help you realize that in a lot of cases, nothing horrible comes from being uncomfortable. You can learn to handle feelings and allow them to pass and move on. And again, I stress that mental health person would be of assistance to help you through and guide you through this process. So I hope that this information was helpful for you today, and I hope you enjoy the remainder of your day.